Good morning. Today we will be discussing an emergent public health concern of drug-resistant gonorrhea, also known as antimicrobial resistance, and what we need to know. So gonorrhea is an STI that remains a major public health concern. The World Health Organization estimated that in 2020 there were about 82.4 million new cases in adolescents and adults 15 to 49 worldwide. Currently, we are facing an antibiotic-resistant gonorrhea. So what this means is that the germs are not killed and continue to grow. Gonorrhea has developed a resistance to nearly all the antibiotics that have been used previously for its treatment. We have one last recommended and effective class of antibiotics, cephalosporins, and this is used to treat the infection. So Neisseria gonorrhoeae is a bacterium that causes gonorrhea, and it is a sexually transmitted infection. It can grow and multiply in warm, moist environments such as the reproductive tract. It is also commonly known with slang of the clap or drip, and it is spread through sexual fluids, including vaginal fluids, semen. It can be spread through oral sex, anal sex, and by sharing sex toys. So what risk factors do we see? We typically see it in people under 25, people with a history of STIs, and people who don't use safe sex practices such as condoms and dental dams, and people who have sex with multiple partners and do not get tested. We've also linked illicit drug use because it shows risk-taking behavior. Specifically, when testing antibiotic-resistant gonorrhea, you need to do a culture swab or an NAAT. This is the test that determines if the bacteria that has caused the gonorrhea is resistant to certain antibiotics. This can be done at state and local health departments, emergency departments, and sexual health clinics. The symptoms are very similar to regular gonorrhea, but they may be more severe or persistent, such as pain and burning during urination, thick yellow or green discharge from the penis or vagina, fever, and joint pain. So it is contagious from infection till at least 7 days after completing your antibiotic treatment. You must abstain from all sexual activity during this time to prevent spreading of the infection. Just because you show no symptoms does not mean you're not contagious. So you could still be contagious. From exposure to symptoms can take 2 to 5 days. And it's important to follow up after completing treatment. There are long-term effects from untreated gonorrhea that can have effects on fertility, reproductive organs, and even heart failure. So what does clinic staff need to know? Even though it is transmitted through sexual fluids and sexual interactions, we still want to use standard precautions when meeting with patients. So this includes proper hand hygiene, washing thoroughly with soap and water before and after patient contact, donning proper PPE, such as gloves and gowns, when potential contact with body fluids is anticipated, and properly disposing of contaminated materials. When visiting with patients, we want to clean and disinfect patient rooms. So this would focus on high-touch surfaces such as bed rails, doorknobs, light switches, faucets, bedside tables, and use an EPA-registered disinfectant against bacteria following the manufacturer's instructions for dilution and contact time. Cleaning protocol needs that the rooms need to be cleaned and disinfected after each patient is discharged. If you want to learn more, you can visit the Center for Disease Control and Prevention as well as the World Health Organization. Thank you so much for your time this morning.